and our studies were conducted in Department of Pharmacology and Department of Biology, Medical of Silesia in Katowice, Poland. Because our studies are concentrated on better cognition, glioma biology, in the beginning, this project, we answered the question ourselves: can adjuvant therapy with antidepressant drugs influence on glioblastoma multiforme stem cell population? But why are we interested in influence of antidepressant drugs on glioma stem-like cell population? Glioma still remains the one of deadliest and the most devastating form of cancer in the central nervous system, and despite available therapies, the median survival still ranges from 2 to 15 months. And we have to remember that even 90% of glioma patients during standard therapy needs support from psychiatrists because they suffer from neurological disturbances and depression. Depression in glioma patients has many phases because on the one hand is a consequence of tumor grade or tumor size or psychiatric history of these patients, but on the other hand can be a consequence of standard treatment like surgical therapy or chemotherapy or radiotherapy or even steroid treatment. And beside the mood disturbances typical for depression picture, these patients complain about cognitive, anxiety, sleep and appetite disturbances. We have to know that antidepressant drugs are used not only for treatment of depression, because they have an important position in adjuvant therapy in cancer, especially in patients with chronic pain, neuropathic pain, and for migraine treatment. However, some clinical observations suggest that antidepressants have an influence on effectiveness anti-cancer therapy, but which of antidepressants and how strong effect, we don't know yet. Because standard treatment of glioma is still not effective and induces serious side effects and has many limitations because not of all glioma tumors are resectable, glioma stem-like cells are recognized as the next target for glioma therapy. But what they are, glioma stem-like cells? This is a small population, self-renewal and high infiltrative cells called site population or tumor initiating cells remaining in the brain in spite of sometimes chirurgic resection. And they are able to regenerate all of tumor mass and are able to differentiate into astrocytes or neurons. And according to tumor stem cell hypothesis, they have an important place in resistance to conventional therapies. The aim of our studies was an evaluation influence of antidepressant drugs, imipramine, amitriptyline, fluoxetine, agomelatine, mirtazapine, and escitalopram, or temozolomide, on glioblastoma stem-like cell population. Our studies were conducted in T98 cell line, in sphere system and on flat surfaces. And when spheres reached 100 micrometers, antidepressant drugs were added on concentrations 10 micromoles. In the next step, we detected markers characteristic for glioma stem-like cells by flow cytometry. I would like to stress that all our experiments were conducted in different oxygen conditions and without factors stimulating artificially cell differentiation. Why different oxygen conditions in our experiments? The main idea of all of our studies is reproducing complex and unstable nature of glioma. We have to know that oxygen concentration inside glioma ranges from 0 to 5%, but in normal stage in central nervous system ranges from 10 to 13%. So environment inside glioma is very heterogeneous, and we suppose that differences in oxygen concentrations in glioma are responsible for differences in effectiveness therapy in glioma patient. Hypoxia is an important factor for glioma stem-like cells markers because it induces multidirectional changes in genome, influence on proliferation, cell renewal, and tumorigenicity, and promotes aggressive phenotype of glioma and promotes marker characteristic for glioma stem-like cells. In our studies, we detected such glioma stem-like cells markers as CD44, characteristic for glioma and responsible for cell migration and growth promotion, GFAP, astrocytes marker expressed in undifferentiated gliomas, nestin marker which play an important role in infiltrative surrounding tissues, Ki67 marker for proliferation, and SOX1 and SOX2 transcriptional factors involved in differentiation cells into pluripotent cells. Antidepressant drugs which we used in our experiment are presented in a table, and they were amitriptyline, the most common tricyclic adjuvant used in cancer patients, used not only for treatment of the depression, because it has a role in treatment chronic and neuropathic pain in patients. Imipramine, rarely used in treatment major depression, because it's reference drug for many in vitro and in vivo studies. Fluoxetine, selective serotonin reuptake inhibitor, used for treatment depressive and appetite disorders. Escitalopram belongs to the same group, SSRI, and effective in treatment anxiety and panic disorders. Used also for prevention depression in head and neck cancer patients. Agomelatine, melatonin receptor agonist, used in therapy major depression, and for resynchronization circadian rhythms. And mirtazapine, very helpful drug, especially for patients with cachexia syndrome, because it is known to stimulate appetite and increase weight gain. And temozolomid, well-known cytotoxic drug used for treatment glioblastoma multiforme. Our results show that antidepressant drug had a strong effect on markers characteristic for glioma stem-like cells, and shown differences between antidepressant action. Our result stressed also that oxygen concentration was a very important factor for glioma stem-like cells. Please compare results in standard laboratory conditions and chronic hypoxia. For example, for CD44 marker, because in standard laboratory conditions this marker was not detected, and all markers, Ki67, GFAP, nestin, SOX1 and SOX2 were in the same level for in every groups. Control and group with antidepressants and temozolomid. And the situation was quite different in chronic hypoxia. Previously, it has been noticed that antidepressant drugs play a critical role in the initiation of neurogenesis in hippocampus. Through antidepressant treatment, the patient's stem cells are stimulated to make more neurons. Antidepressant drug reverse the loss of adult neural stem cells following chronic stress. In this aspect, our results show for the first time that antidepressants can also modulate an expression glioma stem cell markers with different intensity in different oxygen conditions, an average hypoxia for glioma, chronic hypoxia, hypoxia-oxygenation state, and standard laboratory conditions. Our results show that imipramine and amitriptyline had a similar effect on glioma stem-like cells, and both of them induced upregulation of nestin by 40% and 37% in average hypoxia for glioma, and induced downregulation of Ki67. It is suggested that nestin upregulation may be a reason for increased cellular migration and their infiltration to the surrounding tissues with downregulation of their proliferation according hypothesis go or growth for glioma. Escitalopram induced a strong effect on downregulation of Ki67, 90% versus control, nestin, SOX1, SOX2, and GFAP marker in average and chronic hypoxia. So escitalopram seems to be recommended for glioma patients because this drug caused cleaning of cell surface from typical glioma markers and reversed aggressive phenotype of glioma cells. Fluoxetine, SSRI drug, in each oxygen model did not change cancer stem profile significantly, so this drug seems to be neutral during therapy in glioma patients. Mirtazapine had no influence on CD44 profile in our experiments, but cells exposed to this drug did not express nestin, SOX1, SOX2, GFAP in hypoxia-oxygenation model. Agomelatine decreased expression of nestin, Ki67 and CD44 marker in a chronic hypoxia, so this drug seems to be recommended also for patients with a tumor characterized by prevalence 1% of oxygen inside. Temozolomide did not change expression of CD44, SOX1 and SOX2 GFAP markers significantly. Our conclusions. Reproducing of tumor environment in experimental models is necessary for a better cognition of glioma heterogeneity, because when experimental are conducted in one oxygen condition only, we create too stable and unreal environment, what is opposite to its heterogeneous nature. Our results show also that glioma stem-like cells are very plastic, and they can be modulated by factors like glucose, like oxygen concentrations, and can be modulated by antidepressant drugs. And this thing is important, for example, maybe valuable idea for creation new glioma therapies. And moreover, reversion aggressive phenotype by antidepressant can be important, valuable, can be an important idea for better cognition of antidepressant action. But further studies are needed for estimation of factors responsible for these changes in phenotype stem cells at the cellular level. And the last my thing is that influence on glioma stem cells may be important therapeutic target, not only to achieve cure, but even to reduce tumor relapse and improve overall survival. Thank you for your attention.
Any questions? Thank you very much for your talk. Very interesting. Taking a subject that became very trendy in the last 2 months. Okay.
I'm not sure if I read it well. Yeah, it was a very good talk. Thank you. There was in one of the slides about a particular antidepressant being able to induce the growth of new neurons. Is that right?
Yes, some studies in vitro level suggest that antidepressant drugs like imipramine can differentiate glial cells, astrocytes, into neurons, but this is change not functional, but only phenotype.
Do you have any idea about how they're able to do this? I mean, my understanding must be very old. There's this thing about nerve cells not being able to regenerate or something. Is that understanding changing now?
but this changing is associated with changing phenotype this cells, but further studies are needed to answer this question.